Coming from the view or from the professional part of healthcare that I have been very privileged to be involved, we are drawn into very, very vulnerable situations. Birth and death are significant moments in people's lives. And to be a part of this significant moment is a sacred privilege. And I've always looked upon that as a privilege. And privileges are lined with responsibilities. Today, I'm going to spend the rest of this time talking about why birth and the way women give birth is so vital in birthing the next humanity or the new humanity. Why? Because the way we are born and the way we give birth has long-term implications on a woman and the bonding that exists with her baby. If a woman gives birth in an environment where all the people in that room, her midwife, her nurse, her doctor, are caring, supportive, and there is no fear in her, then she emerges as a very confident mother, stepping into motherhood with tremendous confidence and security emotionally. But if she's in an environment where there's abuse, disrespect, lack of privacy, dignity, her choices are not respected, she is traumatized for life. And that's why there's something called human rights in childbirth. And India hosted this conference in 2017. And a lot of us have forgotten that birthing women have this fundamental human right to choose where they want to birth, who they want in the room, and the mode of birth. And there's a very thin line between respecting a woman and giving her that choice, telling her all the pros and cons, and she still has the right to decline treatment. So what matters to women during childbirth? This is an amazing systematic review that came out in 2018. Women want a positive experience. It doesn't matter if they have a normal birth or if they have a cesarean. What they want to feel at the end of it is, I was treated with respect and dignity. Of course, they want a healthy baby, but they want to be in a safe environment, psychologically safe environment. And I draw your attention to the last, which fits in with our title, emotional support from competent and kind clinical staff. So cure and care go together. Now, birth experiences, and I feel very, very strongly about this because this is evidence that is emerging more and more in the last 10 to 15 years. We know that birth is a significant event, and this transition of this young girl becoming a mother, because at birth, it's not just the birth of a baby, it's also the birth of a mother, particularly if it's the first time she's giving birth. Her entire self-esteem, emotional, mental health depends on how that experience affected her. And what I found was even more interesting when I started working with midwives and began midwifery training 11 years ago, is that birth memories last a lifetime. Women remember every bit of conversation that happened in that birthing room, and it stays with them for life. And this has certainly changed the way we practice in Fernandez today.